It's scary with a countdown. I wish you could just, I wouldn't know about it.
That's right. Well, we're live now, so
All right, so I'm gonna share my screen. Ellen, you still run the show. If you guys can't see or anything, just let me know.
you got it. Well, welcome everybody to this fabulous webinar that Dr. Chad Thorpe is going to have for us today. So he is actually, no, I'm not even going to steal his thunder. I'm going to let him talk a little bit about who he is and where he comes from, because he is a fabulous resource here in Southwest Michigan, but he treats patients from all over. It's not just from a typical, 20-mile radius. You're going to find that he treats people all over the country with this specialty. So we are really lucky to have him here. So I am Dr. Ellen. And so I own Mindset Physical Therapy, where we work with people who have complex medical conditions, find the root source of their problem to help them with pain and living a wonderful life. And so you'll see Dr. Chad talks quite a bit about helping people lead their best lives and how there's such an overlap in the mindset between our practices. And you'll understand why I think he's just one great human being. So without further ado, Dr. Chad, the floor is yours.
Thank you, Ellen. And before I get started, can everybody see the screen okay?
You are looking good.
Cool. Thank you so much for having me on. This is awesome. I don't know how many of you guys have seen some of these other webinars, but I was looking through them earlier this week. It's so amazing that there's so much good info from Dr. Ellen and Carrie and Kara and a lot of the people at Mindset. This is what I'm talking about today: TMJ and sleep therapy, pain, sleep, all that kind of stuff is, like Ellen said, very interrelated to the things that she does. So I'll get right into it. That's the first time and only time I've worn a tie, I think, in the last 4 years. So savor that photo. Just a little background about me. I went to Western Michigan. That's why I'm in this area. Ohio State for dental school. And I graduated in 2013, and then right away got into practice in Centerville, Michigan. Kind of always wanted to do the small town dentistry thing and really have some skin in the game in the community. Ellen and I work, we're probably maybe 45 to 50 minutes from Ellen. But like she said, we see patients from all over, especially for TMJ and pain. I think the farthest away right now we have a patient is from Montana. That's rare, but there's a few that'll make those trips. How I got into this: I took a mini residency in TMJ and sleep therapy a few years ago, and I also was a patient first. So I've been a patient of Dr. Ellen's for some back and hip pain for years and years. She's my go-to anytime I need tune-ups, if I've got injuries, that kind of stuff. I also am a mild sleep apneic, and I have a history of TMD. So I got a lot of my treatment from a guy named Dr. Daniel Clower, who I'll have some slides on in a bit. And he treated me before I got started, and then I kind of just bugged him and annoyed him until he started teaching me some of the stuff and where to go, and that's how I ended up working with him. So this is where we work. I work in Centerville, like Ellen said. We have a general practice office. My wife is actually a dentist also. So we both do a lot of the general dentistry, and then she also does functional tongue ties, implant surgeries, and I do a lot of the TMJ sleep stuff. Ellen, yesterday, I think I was watching one of her webinars. She had a line that really stuck out with me. I actually wrote it down on a sticky note while I was watching this. She said, the goal of these webinars is to help with essential components of your health. And that's pretty much right in line with our mission. So our mission at our office is to empower people to become the best versions of themselves. Pretty simple. This is kind of how we do it. This is our quick proven process when you come in. First and foremost always is the connection. So we always want to identify your victory. We want to figure out your pathway to health and get to know you as a person. And then we do the general dentistry stuff, control disease. We treat the gums, connect you with any specialists like Dr. Ellen and her team. And then we, from there, try to build a stable foundation. And from there, the whole goal of our office is that you don't really need me or our team the rest of your life. You can get the tools that you need, very similar to in these webinars, so that you can thrive at home. I do have news for everybody. You guys are elite in that you are seeking improved health, seeking knowledge and information to become the best versions of yourselves, but that is step one. A favorite saying that I tell people all the time here is, if all we needed was knowledge, everybody would be a millionaire with six packs. So knowledge always is step one. The step after that is action, thriving, getting a team in your place so that you can start to be better. And that's what people like Dr. Ellen and her coaches are all for. So I applaud her, and she's been a tremendous success in my life in that step 4 in our path, which is helping people thrive. Her team, Dr. Daniel Clower from Granger, Indiana, like I was telling you, is the guy that got me into this stuff. And he and I basically partnered up. So we work with myofunctional therapists, we work with dentists in Fort Wayne, and then I have our office in Centerville. It's a team that's growing with a very similar mission. And more and more people we're finding have a lot of these symptoms and problems. And so the offices keep growing. He actually, like me, and I don't think he's picked up a drill in probably 5 years. I think he treats essentially 100%, maybe 99% TMJ, sleep breathing disorders, things like that. Here's what we treat in our office: sleep disorders, neuropathic disorders, muscle disorders, temporomandibular joint headaches, head and neck pain, airway and breathing problems. It all basically sums up to breathing disorders and sleep problems and headaches, head and neck pain. So that's how dentists kind of get into it. This is our window into the body a lot of times, which is fancy word, bruxism. It's basically clenching and grinding. Huge links between that and pain, breathing problems, headaches, neck pain, all that kind of stuff. Dentists are set up well to treat this stuff because we live in your mouth all the time. And you can see pretty easily that bruxism flattens teeth, wears them out, all that kind of stuff. My mindset quite often, I spent most of my career treating symptoms. And what we've learned over the years is a lot of the things you go to the dentist for, chipped teeth, broken teeth, worn out teeth, gum problems like recession, those are not usually the main cause of the problem. Those are the symptoms from an underlying problem. So, it's the difference between what they call palliative care and therapeutic care, or allopathic medicine versus more of the functional integrative stuff. We're looking more for sources than we are just trying to fix problems. You got to do both, but it's always good to find a source. So when we talk about essential components of your health, like Dr. Ellen was saying, sleep is pretty important. Everybody has heroes in their life. You got to have heroes. One of mine, Dr. Ellen knows, is Laird Hamilton, the big wave surfer, crazy man, wild man guy, who's also big into health. I heard an interview with him. Somebody asked him, for some of the key components of health, how they can feel better, how they can get more energy, all that stuff. And he pretty much said, look, if you're not getting 7 to 9 hours of quality sleep, just leave. I'm not talking to you yet. You gotta go home and sleep first. It's good for body restoration. That's what that deep sleep, that non-REM sleep is for. And it also is good for your brain. So if it's good enough for Laird, it's definitely good enough for me. We do know that it has huge, huge consequences to health. So there's 3 common sleep disruptions. One is snoring and sleep apnea, which is more my wheelhouse. Shift work, late night shifts, all that kind of stuff. And then insomnia. Those are the big 3. Any disruption in sleep that doesn't get you down into those deeper stages is really going to screw with your health. So that's what we focus on. If anybody is wondering exactly what apnea is, it's the cessation of breathing. So it's when you stop breathing for a certain amount of time over a certain time period at night. And it's got a lot of health implications. You're more likely to have diabetes, high blood pressure, heart disease, depression, mood disorders, that kind of stuff. I heard one pretty staggering statistic, which is if you've got apnea that's not getting treated, it's going to take 8 years off your life. So it's a serious thing. It makes sense. I mean, sleep is important to the human body, and breathing is important to the human body. So if you're not breathing when you're sleeping, you're going to have some rough health effects. I do want to emphasize too, it's not just about apnea. Snoring is a breathing disorder too. And that's a really, really key differentiation between what just treating apnea will do and treating the actual. So we look a little deeper than just do you have apnea. Some people will have no problems with apnea. We'll send them to get a sleep study. They'll come back in a month and I'll say, how'd the sleep study go? Great, I don't have apnea. And I say, oh, that's good. Are you feeling better? Well, no, my headaches are still terrible. I don't wake up rested. I don't wake up, feeling ready to go. I still have neck pain. I'm tired at 2 p.m. And I said, okay, well, do you think apnea was the problem? No, it's probably not. So there's other stuff going on, and that's really what we've got to dive into. It's estimated 1 in 4 people snore. So that's, 75 million people. It's a pretty simple reason behind snoring when we look at images like this. So that number 1 is the back of your tongue. Ellen, can you see my cursor when I do this or no? You can? Okay. So right there, that's our tongue. This is the back of our throat. The best comparison I can make is if you have resistance, when you breathe in through your nose, it's kind of like sucking a really thick smoothie through a really thin straw. And if that tongue is way far back here and you've got to put extra force on it, that's where the noise comes from. And this is me upright. Obviously, when I'm sleeping, my muscles relax and gravity comes into play. And that's where you've got the spouse that really has noisy breathing at night. And I'll tell you, probably half the patients that I see, it's not them coming in for their snoring concerns, it's their spouse. And if we really wanted to make it easy and get people in and out of here really quickly, we would just give them something to either plug their nose with or tell them to sleep in different rooms. But that would not be treating the source of the problem, so we move on from there. It's a real problem. And what we also find with snoring, sleep breathing problems, it's very hard to separate from a sleep problem. So when patients come see me, it doesn't really matter to me if they're coming because of head and neck pain or they're coming because they're snoring, because I've found that you really can't separate the two. If people come in because of snoring as their main concern, and you ask them if they have head and neck pain, very often they say yes. And if they come in with neck pain and head pain, headaches in the morning, that kind of stuff, very often you'll find out either through a sleep study or through talking with the spouses that they do breathe with their mouth open at night and they make noise. So it's hard to separate the two. Ellen had, I think it was her second webinar, was talking about oxygen in the muscles and the tissues and all that stuff. And morning headaches, a lot of times what we find is just if you aren't breathing as well as you can at night and you're deoxygenating your system, it's going to lead to all that inflammation she talked about. And that inflammation can cause muscle hypertonicity, muscles flexing too hard basically, and it can also cause pain in those areas. So believe it or not, most of the time when people come in for TMJ problems, I think I can count on my hand. It's probably 0, maybe 1 that has come in and said, Dr. Chad, my jaw hurts right here because at night I have a hard time breathing. So I clench and grind my teeth and I'm getting pain. So can you fix me? I don't think that's ever happened. Usually they come in and they say, I have headaches right here, or I have neck pain right here. Those are the two most common areas. And Ellen can tell you this, but orthopedic surgeons a lot of times will tell you wherever the patient is pointing, that's probably not the source of the problem. If they come in pointing at their knee, it's very rarely the source of the problem. Dr. Clower's favorite analogy that I hear all the time is, if you have a pebble in your shoe, your foot's going to start hurting, and then your other knee is going to start hurting, and then your other hip's going to start hurting, and pretty soon the hip and knee is going to be so bad that you ignore the pebble in your shoe. And so my job and his job and Dr. Ellen's job is just to look at the shoe again. And that's really why we can't separate the pain, because a lot of times that's what's going on, is you just have to look for the source. So this is a lot of times the source. Good sleep requires an open airway. We take 3D images, which I'll show you later what the machine looks like. We take 3D images basically from the top of your head, so these are the eyeballs, through the nose, and then this is cut off, but all the way down into the chin area, and you get all the teeth and everything. And so what this is showing is your airway starts at your nose, and a lot of people, more than you would think and more than I would think, have a lot of obstructions in their nose. They've got bone spurs, or they've got sinus problems because of their diet or allergies, and they're literally just plugged up. And some people, like me, have valve collapse. That's what this middle one is showing, where you just physically can't get a lot of air through your nose. And our brains are pretty smart. Our brains like being alive. If I do this and can't breathe, my brain is going to make the choice to do that. So it's just making a flow calculation. And a lot of times at night, that's what will happen is resistance is up in the nose. Let's do this, because your body will pick stay alive over pain every day of the week. So I talk more about noses these days than I ever thought I would as a dentist, but it's a lot of times the source of some of these. More in my wheelhouse now. We also look at the lower airway similar to before. There's a little cartoon that, if you've got a jaw that's protruded, if you've got a tongue that does not have space, it's going to go somewhere, and a lot of times it'll block an airway and make tiny little airways. So we always are looking at that too on the image. This is a video. Now, I don't think there's sound. Ellen and I were testing it, but I want to show it. So this is healthy breathing in through your nose, all the way down your throat. And sometimes, for whatever reason, food, like Carrie was talking about yesterday, allergies, something can cause tonsils, inflammation in the airway, that kind of stuff. And then die, and it'll start breathing through your mouth. And as that happens, you get tongue posture that goes lower. And when your tongue posture goes lower, a lot of muscles cause different changes. Ellen was talking about Wolff's Law the other day. Muscle beats bone. That's the easiest way to put that. So all of these muscles start to condense the bone in your body, and that's where crooked teeth come from. Which, if you would ask me in dental school, I would not have known what causes crooked teeth. But we know now that breathing dysfunction can cause muscle dysfunction, which causes bony changes that make tooth problems. And then it's just a terrible cascade. Your swallowing starts to have different movements. Your tongue starts to push outward on teeth. All the forces change throughout it. And that's when we'll see really, really significant tooth changes. And that's how I see this stuff. When you look at someone's teeth, they aren't the right shape, or there's a big drop off on the back teeth, or everything starts to shift and they start to grind and clench. So that's what this video is showing, is just all those times. I don't know if any of you guys have ever said, like, my bite just fell off this morning, or I had pain and problems. A lot of times it's this, it's just your jaw joints slipping off. And if this is all one piece and something's out of position, everything else is going to feel out of position. And that's when you see all these muscle changes and you see all this pain. Now what it's showing is that click. So I don't know how many people on this video have a click when they open. But like Dr. Ellen says, when I go in and my knee clicks, if it doesn't hurt now, it's going to hurt later. And that's all that is a joint slipping off of its disc and making lots of noise and lots of problems. So if it doesn't hurt now, it's going to hurt soon. And I use that quite often. It's just an alarm clock, telling you that something's off. And you can see all the changes. All the teeth start to flatten. Everything starts to get worse. And then obviously the joint gets more and more out of position. And eventually there's just terrible pain, terrible problems. Or you start getting that feared phrase that everybody hears from orthopedic surgeons, bone on bone. That blue disc in the video, that is a nice, big, fat, thick thing. It's almost like a callus. If you're not on the callus, something else, and a lot of times that's nerves, veins, something like that that's causing a lot of pain. And then you'll get an even bigger cascade of problems. So Ellen talked once about posture. Forward head posture can put a whole bunch of load on your muscles and spine. So that's a lot of times what we see, a lot of postural problems. If you've got problems breathing, if you've got jaw pain that you avoid, you're going to posture forward, and that's where I see a lot of these kind of patients. It's not my jaw hurts, it's the back of my head hurts. So it is important to note with all this kind of stuff, just because you're breathing through your mouth does not mean you have apnea or you're going to have apnea. But most apnea starts with snoring, which starts with noisy breathing. It starts with mouth breathing. So any domino system like this, it's obviously way easier to clean up when you start earlier in the system. So that's why we identify this stuff really, really early, and then the treatment's less complex. So what is ideal breathing? We kind of touched on this already. It's nasal breathing. Don't let anybody tell you different. If you're not breathing through your nose, you're not breathing ideal for a human. And there's a lot of reasons that nasal breathing is important. It warms the air. It humidifies it, it cleans it, it is antimicrobial, antioxidants, it's a smooth muscle relaxant. You guys have all felt it. I did the breathing exercise on Ellen's last webinar as well. If you sit there and take 10 light nasal breaths, you can physically feel yourself relax in different areas. And it's really important for development, for muscle relaxant, all kinds of stuff. Pulmonologists will tell you breathing through your mouth chronically can lead to inflammation. Inflammation is the precursor to most, if not all, pain. So anytime we can make our system less inflammatory, we're winning and we're becoming better. I did not ever learn about nitric oxide in dental school, but it is something that's in a very high concentration in your sinuses, and it does a whole bunch of stuff for your body in a good way. It promotes the natural rest state in your nervous system. It helps with blood pressure regulation, pain management, digestion, sexual health, cell proliferation. It helps your immune system. The list goes on and on. And really the only place that it's in high concentrations is in your sinus, and it's only really released when you're properly breathing through your nose. People buy this stuff. I think there's even you might be able to nod and tell me, I think there's sports drinks that are nitric oxide related sports drinks. And the cool thing that we're learning, it's kind of back to basics, is your body does a lot of this stuff on its own. You can make nitric oxide on your own with simple breathing exercises. So it's a huge factor in all this, and it really only helps with nasal breathing. So this is another really good focus that I'd want you guys to get out of this is, yes, sleep and breathing is important, but usually, I really am not a fan of physicians and doctors and people saying, it's a sleep breathing disorder, because I don't know anybody who only breathes at night. Most people also breathe during the daytime. So most of these problems are 24/7 problems. These are really cool videos. So this is actually at Dr. Clower's office. He's the head honcho when it comes to this stuff. I wanted to show you guys just some of the muscle changes that can happen with breathing problems. So video of how this guy talks. You can see how he kind of has that side talk look, and his jaw kind of juts to the side. And then Dr. Clower is going to have him open, and I want you to watch all the face muscles that he has to use to open. So you can see how he's got a whole bunch of muscle movement when he's opening and when he's talking. I've worked out before too hard, and the main thing that happens to my muscles is the next day they get sore. So if you have to overuse all that. Dilator in. He sprayed some natural nasal mist, and look at him talk now. Very minimal jaw movement, very minimal muscle and face movement when he opens. And these videos were taken probably 5 minutes. It's a very, very simple thing. I'll show you the before again. It makes sense that it's simple, right? I mean, your body should prioritize breathing. So when you see someone with an open nasal passage making these muscle changes, it's pretty significant. And this is in 5 minutes. Imagine having to talk like this all day, and imagine having to open your mouth like that all day. Your muscles will get tired, and that's where a lot of pain comes from. So again, it's not just a nighttime problem. You guys all breathe all day, so this is something that we need to be aware of all day. So what do we look for? And what should you guys all look for as patients, humans, people trying to become better? I'll show you that in a second, but first we want to kind of make some notes here. There is a difference between adults and children and how we treat this stuff. You really can only manage obstructive sleep apnea, OSA, if you are an adult. You're not going to cure apnea. I have apnea, mild apnea. It's not curable, but it's manageable. Earlier you treat a jaw joint problem, easier just to treat, just like any pain problem. Now the cool thing about kids is you can cure or prevent OSA in children. The earlier you catch it, the more changes and developmental improvements can be made. And a lot of times these people just develop out of it. The AAP protocol for snoring, so that's the American Academy of Pediatrics. So what they tell you, this is your child's physician. So their board says every child should be screened for snoring, which means if your pediatrician is not asking if your child snores, then you should be doing the asking for them. And it goes on to say if the answer from a parent is yes, my kid snores, they should be screened and have a sleep study. So it is something that people are more and more aware of. The next step is just figuring out how to treat it. But that's the cool thing about kids. I mean, more and more now, people used to come in and, oh, my child's tonsils are so big. What should we do? And you tell a doctor that tonsils are too big and they're going to take the tonsils out. But most of the time they grow back. And it's because a lot of times the tonsils were not the problem. The lack of nasal breathing was the problem because of food, because of allergies, because of whatever it was. Check Carrie's webinar last week because I had similar stuff on it. But it is important to note that, kids, this is a curable thing. So catch this stuff early. This in our office, you see this every day, all day. 80% of our patients have this kind of stuff. You're all welcome to go look in the mirror right now. That is not normal. That does not happen with age. That happens with too much clenching, too much movement. the most significant stat probably is that at night, because so many of our systems are off, we actually get to bite 5 times is a lot. So that's why most of this problem, the source of it is nighttime, and then we wake up and we have to deal with it. So we look for worn teeth, different areas, different positions. A lot of times that's a problem. And we look for tori. So I don't know if everybody knows what tori is. I learned what the word meant in dental school. When you asked a professor, what does a tori come from? They would say, well, it's tori. So what we know now from taking all those residencies is this is another extrapolation of Wolff's Law, which Ellen talked about. The simplest explanation of Wolff's Law is a force on bone by a muscle can cause bony changes. So these little bumps that some of you may have on the roof of your mouth, if you want to stick your fingers in there, feel free. Roof of your mouth, inside your tongue, outside your gums, those are muscle attachments. If your muscles are not working the way they should, the bone will make changes. So those are some of the kind of Sherlock Holmes factors we're looking at when we start treating this stuff. Usually this just leads to a question. I'll say, I see a lot of factors related to a breathing dysfunction, head and neck pain, sleep problems. Do you wake up feeling rested? Do you get headaches often? That kind of stuff. And if the answer is yes, that's where the conversation starts. So again, the answer is not, hey, I see that your teeth are crooked, let's straighten your teeth. It's, hey, I see that your teeth are crooked. Do you have dry mouth when you wake up? Do you have headaches? Do you have neck pain? Do you wake up feeling refreshed? It's the conversation starter. You can still get straight teeth. They look nice, they function better, but we also got to get to the source. We talk about this a lot. Ellen is the master of posture. There's all kinds of changes that happen to your body. And if you're an asymmetrical person, like this lady is, and you're biting with 5 times the force at night, there's going to be a lot of pain associated with some of those tight muscles that are always under tension. The most lasting thing or description that I've heard of this, I have a picture of just head and neck, but this obviously goes way beyond just the head, is imagine if we have just a string, a plumb line, and our body is trying to hold posture all day. If you've ever tried to flex a muscle for 20 hours, it gets pretty sore. That is not really how posture looks. This is more Ellen's expertise, so she can get in more detail, but muscles have to relax and contract all day, every day. It can't stay under tension all day. So if you're a symmetrical person, those muscles will relax and contract symmetrically. If you're out of alignment, one's going to have to work harder, and that's a lot of times a source of pain. So we look for asymmetries a lot. Asymmetries in the face. We also look for that forward head posture. So Ellen, I think this is the same stat you had, but normal head weight of 8 to 10 pounds, every inch forward will add about 10 pounds on your spine. So most of the patients we see have maybe 3 to 4 inches of forward head posture. So to put that into a more realistic term, if you've got 3 inches of forward head posture, you essentially have 3 bowling balls on your head, and you're walking around all day. And it can lead to a lot of pain, a lot of problems, a lot of tension. These are some of the main kind of trigger point areas that we see in patients that come in. Those are some of the chief concerns. It's not jaw pain. It's a lot of times back of the head, it's shoulders, it's traps, all kinds of these areas. Ellen has worked on me before. She knows this big muscle, this trapezius muscle on me is very often tight. So a lot of that mid-back pain, a lot of that stuff is very postural based. This is another one. This is a pretty big indicator, tongue scalloping, that you have some type of breathing problem. All these little indentations on your tongue, those are the scallops. Those are imprints of teeth. So it's just showing you it in your mouth, somewhere it's pressing on teeth. I used to think it was tongue too big. People would say, oh yeah, I have a big tongue. What we know now, it's not tongue too big. It's jaw too small. So you guys have probably seen pictures of cavemen, pictures of Neanderthals. What do they all have in common? Big jaw complexes. Everything is out forward. And that naturally will bring more space for the tongue. If the tongue can go forward, the airway gets bigger. You don't have to posture forward to make big airway changes. Us, as we're developing, getting smaller and smaller jaws, crookeder and crookeder teeth, that tongue has got to go somewhere. That's where we find all the snoring, all the breathing problems, all the postural problems. So that's a big one. That's, I think, about 70% predictive for a diagnosis of apnea. So here's ideal tongue position. This is 1,000-year-old knowledge, guys. I mean, you guys, if you've ever meditated, which I'm sure some of you do, since you guys are, they always tell you tongue up on your front teeth, up on the roof of your mouth. That's normal, optimal airway. That's also where your muscles are most relaxed. So anything beyond tongue suction to the roof of your mouth, a lot of tension on those muscles, and that's where all this pain comes from. Also that obstructive apnea, it's a repeat symptom. There's gravity helping keep people from breathing at night. So we'll go big picture for a little bit. This is where I love working with Dr. Ellen and Carrie. And how does this happen big picture? Hippocrates had it right a long, long time ago. Let food be thy medicine. First scale evidence of dental cavities, which is my wheelhouse as a dentist, appeared in the skeletal record 10 to 12,000 years ago. The other thing that happened 12,000 years ago is we started farming wheat, and wheat-based products became a very big part of our diet. And about 300 years ago, the Industrial Revolution happened. That's when we started actually processing food. That is the first sign that we saw of crooked teeth, poorly developed jaws, all that kind of jaw joint pain and related stuff. So this, I tell patients all the time, if we want to control this thing, we've got to control 4 things. You've got to control the weird movement, punching, the grinding, the whatever it is. We've got to control the airway, how you breathe through your nose. We've got to control inflammation, and we've got to control nutrition. And nutrition is the simplest and most difficult at the exact same time, right? Crap food is everywhere. There's processed food everywhere. You need someone like Carrie and the team there to really help guide through that stuff. But the simpler you can make it, the better. We tell people we want you on an anti-inflammatory diet. You should be eating plants and animals. You know, and then as we grow, our office is really evolving more from just symptom treatment, more toward wellness and what's the best way to eat and all that kind of stuff. That's where, you know, we're hoping to get nutritionists in our office, or, you know, functional practitioners that can come in and do wellness webinars, monthly meetings for our patients, that kind of stuff. Because again, this is the key right here for a lot of this stuff. Food is a huge indicator of this stuff. Sarah was talking about it in her webinar yesterday. You know, there's food allergies. There's also, I tell patients that, you know, they brought their kids in to get an allergy test, and they say, oh yeah, there's no allergies to any of this stuff. Allergic reaction is one thing, an adverse reaction to your system is another. And there can be food that puts you in a state of inflammation that does not show up on an allergy test. This just shows people that they're allergic to getting poked in the eye. Because a lot of times it's not about the actual allergic reaction, it's just, is this bad for your system? I drink beer sometimes. I don't know if any of you guys have ever drank beer, but sugar, wheat, processed food like that stuffs my nose up. I usually snore if I drink too much. And it's a very common thing that food like that, sugar, alcohol, wheat, stuffs up your nasal tissue and leads to snoring. And then I usually have headaches in the morning. So I don't want to harp on it too much. You know, talk to Carrie. She's the master at this stuff, but food is a huge part of all of this. So where should you guys start as patients? You know, it's simple. We have screening forms, and they're pretty easy things. If you have heart disease, headaches, acid reflux, insomnia, depression, you've got a history of stroke, diabetes, if you wake up in the middle of the night to pee, if you grind your teeth, you know, if you snore, all of that stuff can be caused by a breathing problem. So it's important to look at all that kind of stuff. A lot of people wonder what treatment actually looks like. You know, what do I actually do for this stuff? You guys have heard of CPAPs. There's also oral appliances. Before we get into any of that, this is usually where I start. So Dr. Olmos, the guy that taught me most of this stuff, says 95% of his success is due to an accurate diagnosis. So we spend 90 minutes evaluating a patient, only TMJ and sleep. If you're a new patient that comes in because you have cavities, if you have broken teeth, that kind of stuff, we'll look at that. And if there's enough stuff related to TMJ and sleep, we will actually bring you back for a second evaluation where we're kind of taking a step back from teeth and looking at this more as an orthopedic or an overall health standpoint. And we're going to take pictures to look at posture. We're going to take a 3D image. We're going to evaluate muscles. We're going to evaluate the nervous system to see if there's any chronic neurologic pain, and we're going to review medical history and any sleep study if you have it. So this is what every patient wants to know that comes in. They want to know what's wrong, they want to know what we can do to help, and they want to know how long it's going to take. Of usually the first 20 or 30 minutes of a consult, they'll know all the answers to that stuff. This is our iCat, so this is that 3D image I was telling you about. We use this pretty much for every patient that comes in. Super low dose, super low radiation. It takes about 8 seconds, so it's not a long thing, and it does an image from here to here in 3D. It feels like cheating. We've had it for 2 years. I don't know how I was a dentist before this. I found so much crap I didn't know was in someone before. I look at noses and work with nose throat doctors way more than I ever thought I would as a dentist, because so much of these problems start in the nose. Here's kind of a picture of what's normal. I hope you guys can see this on your screens, but essentially what we have here is a cut of the jaw joint and a whole bunch of pictures of the jaw. And then this is the person, basically looking down. And then the next picture is someone straight on with a nice healthy nose. You can see all the tissue is pretty open. All this black stuff is what they breathe through. And then they have a nice big open airway. And lo and behold, they have straight teeth. Never had ortho in their life. They've got a nice healthy looking tongue with very little fissures or scallops on it. And their posture is pretty darn good. Ellen, you may be able to tell me if it's not perfect, but it looks pretty good unprompted right there. Normal. So this is actually a person who works with me. She works at our front desk, and you can see this jaw joint here is very beat up, very different from this nice pretty round one. And a lot of times when you have a nasal obstruction, you can put so much force on bone that you're making changes. So this is her deviated septum and her bone spur right there. Another question we always hear about is sleep studies. Lab or at home, a lot of people do not have to get a sleep study. Sometimes they're necessary, especially if you're really, really compromised health, if you've had a history of problems, all that stuff. And they're not that bad. I've been to a few in the area. They're kind of like really simple hotels. You've got a room, you get to sleep, but so I have it right here. So we also have a home sleep study kit. It looks like that. It's got a few less. This is kind of like when you go into a lab. There's 7 leads they put on you typically, sometimes more, measuring all kinds of stuff. It's not as bad as it looks. This one we have, there's a few less leads. So basically the way we tell patients is, in a lab you get worse sleep, but you get better data. At home you get better sleep, but you get less data. A lot of diagnostic, and again, we don't just think about apnea, so it's another piece of the puzzle. It's not the only puzzle. This is typically the 2 main lines of treatment for sleep apnea. You can get a CPAP mask. So this is a very effective procedure or treatment for sleep apnea. This puts positive pressure into your airway so that it stays open so that you can breathe. There's nose piece ones, there's over the mouth ones, there's full headsets. It really just depends. And then this is an example of an oral appliance. So when we talk about volume, if you don't have proper volume, a lot of times positionally, we just have to put you into the right spot so that your body can breathe on its own. And that's what I tell patients. Both of these work. You kind of have 2 choices. You can have a machine breathe for you, or you can try to shim yourself so that you can breathe on your own. These are a few of the examples. That lower right one, that's what mine looks like. I wear that every night. They look like torture devices. I promise you, I've been wearing one for 2 years. They're not as bad as they look. They fit really well. They're 3D printed. They're custom fit using I make them in San Diego and they're pretty great. They're also not the only line of treatment. That's the tangible thing we get. But what I tell people is, you kind of think of them like a shoe. You can't just go into a shoe store and say, hey, how's it going? I need a shoe. And the person says, okay, well, they look on the shelf and here's a shoe. Go home, good luck, don't ever call me again. Very similar with the sleep appliances. I think there's 94 FDA approved sleep appliances out there. I don't really get paid to just pick one. I get paid for the 93 I don't pick, because they all have their different needs. They all have their different advantages. And a lot of times it's just about picking the right one. and about positioning it to the proper spot. It's also, kind of like a shoe. If you've got a hot spot on a shoe, it needs to be adjusted. Very similar here. You can't just give someone one of these and say, good luck, have a good life. You have to follow up. You've got to make sure you're getting improvements. You got to adjust it as needed. What else we do besides just the appliances? We have a really specific bite registration technique that we use. So we're not just taking an impression and then saying, okay, this person's jaw, they need to be jutted forward. What we have to remember as dentists, and then also what we have to remember as patients, is this is a tube. So tubes are round. And if we just take an appliance and jut you forward, you can imagine it kind of like a hula hoop. If you pull on a hula hoop, you're going to make it wider, but the sides are going to get narrow. And it's very similar to your airway. You can't just jerk it forward because you're not going to really make changes. You've got to position it better so that it stays open. We also do some physical therapy and medicine. We have a cold laser. We do sometimes medications. We like to try to stay away and do it a little more non-medical, but if you need to, you need to. And then we also try to do wellness visits and events. This is where things like this, things like Ellen and Mindset do are really beneficial for our patients, because it doesn't take just one or two visits. Usually it takes checking in, it takes continually learning, it takes working with referral partners. There's all kinds of things to this. I'll be the first to tell you, I don't solve all the problems. You can't really treat this stuff in a silo. It's a very, very collaborative way to treat. And a lot of times what I'll find through the exam is, patients really don't even need me. There's a lot of times I just say, you're not in the right spot. It's not TMJ that's causing these problems. It's you have low back pain and you're clenching all day because you're trying to soothe the thing. So yes, I can treat the jaw, but unless you go see Dr. Ellen and she gets your back fixed or your knee fixed, you're going to keep getting jaw pain. So referral partners are huge. A lot of times the main frustrations I've had as a practitioner is I try to help the patient too much and think, they have to see me. It's got to be the jaw. It's got to be the breathing. And I didn't involve referrals quick enough. So that's a huge, huge one that we're getting better and better at with connecting with people like Ellen who can get all these referrals that have the right mindset. There's our cold laser. Some of you guys maybe have seen these things. We use this in the office daily. I use it to unlock jaws. If people have a jaw that's locked, I use it for headaches, neck pain, trigger points, all that kind of stuff. It is not a solution. It is to help reduce inflammation and speed up recovery once you actually find the source. But it's been a great tool for us. Some kids will need this. Some kids will need CPAPs, we found, and they do make them. But a lot of times, children, is you can fix stuff before you get that. So we actually have a myofunctional therapist. So you can think of her as basically a physical therapist for your mouth muscles, your she works with kids. Her job is kind of funny. I like to joke with patients and say her job is essentially to keep me out of business or run me out of business, because the more and more kids she gets to treat, the less and less they become adults that have all these problems. And she's treated people down to I think 1 or 2 years old. And she does it with appliances, she does it with coaching, she does it with nutritional guidance, that kind of stuff. And you see some pretty significant changes pretty quickly. She also works with Dr. Libby. So Dr. Libby does a lot of tongue ties. And tongue tie is a big thing that we'll talk about pretty quickly too. So I'm going to skip that video. It's very similar to the first one, but it's essentially about kids and breathing. I also wanted to make a point. We kind of talk about this with Hippocrates all the time. I get this all the time because a lot of dentists do not talk about this stuff, and a lot of doctors don't talk about this stuff. People want to know, is this new? And I wish I could say yes. I wish I could say, the team of people that I work with are the ones that discovered this, but this ain't true. So early 1900s, they were talking about this stuff. Mouth breathing, tooth crookedness, spatial development. It just hasn't really become a mainstream focus. In my mind, or if you're asking my opinion, it's because I think it fixes stuff too well when you talk about this. So yes, it's been around for a while. This is what it looks like in everyday life. Kids who are sleepy, kids who are irritated, kids with a really, really bad underbite, really overweight with poor posture, low chin development, open lip posture while they're walking around, kids falling asleep in stupid places. I used to think this is cute. Oh, look, they fell asleep on the drawer, on the dresser. This is not cute. This is a person who's very, very tired and fatigued. If you're falling asleep on a staircase on your way to bed, you are too tired. Guys, I talked a little bit about this. So this is Dr. Libby's realm. This is really, 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 really into this. So, she saw a patient a couple weeks ago. I think it was a 4-week-old kid. The reason this is significant is because it physically helps you get your tongue to the right spot. Physically helps you with your breathing. The tongue is connected to the mandible, which is connected to the first 3 vertebrae of the neck. So a lot of these postural problems can be sourced in the tongue. So we always want to make sure that that's clear if it's not. I wanted to make when we're talking about the signs and symptoms of sleep deprivation. You've seen them before. You've probably lived through them before. I know I have. If I have a rough flight or before I got treatment. You can be moody. You have a hard time focusing. You can be irritable. You can have trouble multitasking, coping with stress. Your brain doesn't work right and you're tired. So those are the signs and symptoms of sleep deprivation. Now, I try to be clever because I want to show you the signs and symptoms of ADHD. Problems focusing, irritability, trouble multitasking, trouble coping, decreased cognitive ability, fatigue, sleep deprivation. ADHD. Now, I'm not saying ADHD is not real and some people don't have them. What I'm saying is, shouldn't we try the simpler approach first? And if they're breathing with their mouth open at night, if they're snoring, should we maybe clear and make sure that they're getting all the proper. So that's what unhealthy looks like. It's important to know what healthy looks like because you got to be working toward an ideal. This is optimal breathing for a kid. Quiet breathing, nose only, lips closed, tongue on the roof of your mouth. That's a healthy kid. He's going to get good sleep. Kids is a little different than adults. Again, you don't really need to shim people because they're not done growing. Is the main treatment before we get into meds, surgery, or appliances, or a CPAP. And therapy is essentially just training the muscles, training the breathing so that everything goes to the right spot. That's what Jenny does every day. As weird as it is, you have to treat and help humans learn how to breathe properly these days. And it's because a lot of times they're just not. And it's sometimes it's an actual physical thing. So sometimes it is. They have stuffy noses. They're breathing with their mouth apart. There's another patient that Dr. Zaghi, who's an ENT in Los Angeles that we work with sometimes. He had one who he had a really hard time figuring out why they couldn't breathe properly. And he said what it turned out is the younger brother was watching the older brother breathe, and he was mirroring him, and that's why he was breathing with his lips apart. And once they solved that, they were able to train him properly and get him breathing right and putting all of his muscles in the right spot. So myofunctional therapy, it's a growing part of our practice. I'm really proud of Jenny for learning all this stuff and helping patients with it, and she's getting awesome results with it. Simple goals, you guys can look at this on yourself and with your kids. It's very, very simple what treatment should look like. These are the goals that Jenny has. Your nose, tongue on the roof of your mouth, lips together. Those 3, if you keep it simple, are going to get you some success. Recommendations, these are really, really important things. And again, I am just pretty much regurgitating stuff I learned from other people, but these are some of the great books about this. Your journey starts today. This is not the end. This is an intro to it, but lots of books on nutrition. I don't know if any of you guys have read Fat Chance or Wheat Belly or Grain Brain, any of that stuff. They're all great, great books. If you're really interested in sleep and kind of the science behind it, Why We Sleep is a phenomenal book about all this stuff that really dives deep into sleep. Oxygen Advantage is a great one. It gives breathing exercises, helps unblock your nose, all that kind of stuff. So Jenny actually went to a course with this guy, and she uses most of these methods in her breathing techniques. I've got a couple other books on tongue tie. Let me know, and you can send emails or whatever on any of these books, and I can get people copies. This one, this is Dr. Clower's book called Achieve Your Victory. He is the master in jaw joints. He's the guy I work with. I'm happy to get anybody a copy of this. He's really good at kind of simplifying a lot of these principles so that they're universal and they're easy to understand. So he's a really good guy. He knows what he's doing, and his book is full of good information for you and for your loved ones. That's what I would encourage for most of you guys. I apologize. Every time you go to the grocery store or out in public, once we're allowed to again, you're going to see all these people. And they're all going to look very, very similar. They're going to have their lips open. They're going to have their heads forward. They're going to be overweight and sleepy, and they're going to be irritable. So I've learned, from looking at this stuff that it's pretty prevalent. There's a lot of people everywhere. I commend all of you guys for listening to this and taking the time, because it's rare company, but people that are actually learning about this stuff. And you guys have the power to help other people with this. And it's as simple as it sounds. A lot of doctors like to overcomplicate things, but if you eat right, if you can get breathing properly and get sleeping properly, a lot of the other stuff falls into place. So any questions that you have, I'm happy to answer now. Emails, whatever you guys got. I'll give Ellen all my contact information. I'm happy to help. I love spreading this stuff around because it is not really in the mainstream thinking yet, but I do think it's important. I love fixing teeth, but I think even I would have to say sleep and breathing are more important than teeth. So I appreciate all the time. You guys were awesome. Ellen, thank you so much for the time here.
Absolutely. So we have a couple
questions. I want to end with some pictures.
When you're ready.
Because like I said, if you're going to go in the grocery store and see these people, just need sleep. And you can see the power that a good night's sleep has with people. There's really, really huge changes that can happen when you're able to breathe properly and get a good night's sleep. And it's sometimes just easiest to keep it simple. And this is what you guys have the ability to do when you're seeking, healthcare and seeking improvements in sleep and breathing. Okay. There's me. Email us, call us. We're here. We have one simple mission. Like I told you, we're going to help you guys become the best versions of you. There's 2 other offices. One know if you guys need any help from me. I'm always working with Ellen, talking to her. So, she's a great resource. And
so a couple questions for you, Dr. Chad. So the first one is there hope for someone who has a confirmed deviated septum?
You say that again, my sound was off.
That's right. Sorry, is there hope for someone who has a confirmed deviated septum?
Yeah, I had a deviated septum. So that was one of the main sources of my my problems. So I had a deviated septum and nasal valve collapse, and it led to a lot of bony changes and then what they call turbinate hypertrophy, which all those big bones, as I get back to that slide, they just kind of overgrow. The fix typically for a deviated septum, it's bone. So you got to get a surgeon in there, and you got to work with good surgeons that can do that pretty conservatively. But that's what I did. I had nasal surgery. Dr. Liepert, who works in Indiana, did it. I actually did mine awake because I'm weird and I wanted to see what it felt like so I could tell other people about it. It really is not that bad. I think I got it on a Friday. I went back to work Monday. The first night you feel like you got punched in the nose. The second night you feel like you got the flu. And then I was out chopping wood and running around on the third night. Yeah, short answer, yes. Deviated septum can be fixed. It is bone. So no amount of breathing exercises will fix it, but you can definitely get solutions.
Okay. Now, this is a multi-part question. You know what you do here, and you're talking about a particular type of test. So if you could first talk through that little test, and then talk a little bit about the difference in what you use the breathe right strips for versus the nasal inserts, things like that. If you could talk a little bit about some of those things, we've got some questions rolling about.
Gotcha. Yes. So this is called the Cottles maneuver, COTTLES. A really simple maneuver. So the way the nose works is all this bone, this picture here is actually kind of far back in your nose. This opens up your nasal valves. So you've got little pieces of tissue. You pull it up and back, you kind of widen it. So I actually use this in my exam. This is actually a really powerful one, Ellen, as simple as it looks. You ask someone, can you breathe well through your nose? And the answer is always, yeah, I can breathe well. I can see perfectly fine with my glasses too, but when I get glasses on, I see better, right? So same thing with the nose. If you tell someone, breathe in, and you guys can all do it now, you can feel you breathe a certain way. If we open our valves and breathe again, you can feel the resistance go down. So
get like a little bit of a high. I like it.
Yeah, it is. It's more nitric oxide release. It just helps with the whole system. So I use that a lot, and you can just see people's eyeballs get big. Oh my God, I don't think I've ever breathed through my nose before. And I use it as a really simple test to see if there's valve collapse. And then, breathe right strips, or there's actually, you guys have probably seen them on Amazon. There's things that go up your nose. They're just nasal cones. I'll wash my hands before I see anybody, by the way. There's just cones that you can put up your nose, and all it's doing is opening this up. So it's an important one. Some ENTs will say, don't give people breathe right strips. It's not the solution. I always think the more you can inform a patient and give them tools, even if they're short term, just tell them they're short term and that they may still need to see an ENT or something. It's better than having them keep doing it. And I bring it up for basically every patient because, if you give someone an appliance and you're not giving them a solution to manage their nose, they're going to spit the appliance out at night because that's what they're breathing through.
Yeah, and I think you make a good point too, that you almost use that as a test too, to say, okay, like, does this help you? Because that'll cue you in, like, okay, yes, you can use the breathe right strips and maybe the nasal cones, but you got to get to that root issue, and so you might need to talk to somebody, right? And so if you're at home right now and you are using those, but you're still feeling that fatigue, or you still wake up with that headaches or dry mouth and stuff like that, like, okay, maybe you found some improvement, but you're really not getting to the root source of that problem, like Dr. Chad was talking about. So I think that's really
it won't fix that bone right there. I used to wear breathe right strips and try to do all these breathing exercises, and I just can't do it because I can't breathe good. And it was because I had a piece of bone in my nose that I didn't. So it improves a lot, but it's not the fix. And then to answer your other question quickly on breathe right strips versus cones, I usually tell patients, I don't care what you use. It can go on your nose, it can go up your nose, you can put pieces of tape and pull it back. This is something to get your nose open. Do which one's comfortable.
Mm-hmm. Do what you need to do to get sleep.
Yeah.
Do you see any correlation between difficulty breathing at night along with recurring kind of dreams or some form of maybe different dreams and such that people have, if there's any sort of correlation between dreams and this lack of good sleep?
Not really. I mean, that's a good question. And I've been asked that a few times. I haven't seen really a frequency in like the weirdness of dreams. I do know one of the main indicators that you start to get improved sleep is your dreams start to become, more often or more frequent. A lot of people just aren't getting into deep stages of sleep where they're dreaming. So one of the main things you'll hear is like, people are like, oh my God, I had the best night's sleep. I actually had some dreams and I woke up pretty refreshed. So we see that. But as far as, weirdness of them and stuff, not really. If we're speaking anecdotally, like single events, I know, like my wife, Dr. Libby, and I can speak personally too, when I have more sleep disruptions, I have more vivid and weird dreams. So it could be related to that, but I've never seen any science on it.
Mm-hmm. Now, we had a couple questions ahead of time for people who couldn't make it. So this is going to be for the recording folks. But I had a few parents be interested on what do I look for in my kids? Because I don't necessarily always sleep near my kids. You send them to bed, they put themselves to sleep. So what should a parent be looking for, number one, as far as the sleep goes? And then is there any other signs and symptoms that might be correlated because of I don't mean to like prompt you, but the waking at night with the kiddos, or maybe you and I have spoken before about bedwetting and such. So if you could just speak a little bit for the parents out there. I know we have 3 mamas who ask me questions like this. So this is for you guys.
Those are the good mamas too. The ones that are actually observing and being aware of their kids. That's where it starts. As far as what to look for, like I said, breathing is a 24-hour thing. So you really don't have to watch them sleep. If you see a kid walking around like that all day, he's probably doing it at night too. That being said, if you're looking at night, the main stuff we see, lots of movement, frequent bedwetting, sleeping in weird positions, and then snoring. I mean, shoot, I tell people, keep it simple. You can stick this thing in there. There's an awesome app. It's just called Snore Lab. It's available on any phone. It's literally just a recording device. So I tell patients, if you really want to see, but you don't want to be in there, just put your phone in there at night, push play. It records sounds. If there's 2 people sleeping in the room, obviously, it's going to pick up some noise and you won't be able to narrow it down. But that's a really good one. Everybody's got a video. So that's what I usually tell them to look at. As far as the actual bedwetting and how that's related, so essentially it's kind of like a chemistry problem, and then it's a buildup. So there's actually hormones that get released when you have problems breathing at night that are essentially telling you we need more fluid to go through our bloodstream, and that helps increase urination, because that's what happens. So we see that in adults too. We see it in adults and kids. Frequent urinations at night are a big sign that you're not sleeping properly. It's just the difference is kids will pee in their bed and adults usually wake up.
Mm-hmm. Makes total sense. Makes total sense. The other point I think you had that you've touched on multiple times is the open mouth breathing during the day. And so for folks who are watching this, just start to be aware of that in your own self. I mean, I know people will set alarms to get up and move, especially since we're all in our home environments right now. But use that alarm to just draw attention to yourself and some of those key markers that Dr. Chad just referred to. I think that's super helpful to just say, you know what, are your lips together? Are your teeth apart? Because a lot of people feel like they have to keep those together. And then is your tongue resting on the roof of your mouth? Are you holding those good positions so that you can breathe in that normal airway? I think that's really key. And then something else that one other question that we had before this as well was, I had one woman say, since she's had to wear a mask, the mask that she's wearing wasn't fit well to her. So she found herself opening her mouth to hold the mask down. And she said that she got a lot of jaw pain from holding that position. And so I said, okay, I will make sure to ask Dr. Chad that. So do you have any comments other than, I mean, I think the main source is fit your mask correctly so that you don't have to hold your jaw down in order to hold the mask in place. But do you have any comments on that, since obviously we're in a little bit different world than we used to be 3 months ago?
Yeah. I mean, it's amazing. It's a testament to patients that they're able to stay alive despite doctors' best efforts. Sometimes it's amazing. I mean, I see so much, we call it self-soothing, like that. I mean, someone is putting something on you to help you breathe, and if you physically can't breathe, you got to do something, and you'll figure it out. So I see it a lot. Sometimes it's just, I would encourage everybody, whether it's with your dentist or someone else, you got to look inside the system. Some people that have CPAP masks that keep coming off for the pressure breaks, they have nasal obstructions. It's more common than a lot of stuff, or they have narrow airways. And if you put anything on here and there's too much pressure, the seal breaks. So it's a comfort thing, but it's also some people just have those blockages, and they'll self-shim, they'll self-soothe. We also do another one to speak to that one specifically on. Sometimes you just need combination therapy. So if we haven't developed fully and you have a CPAP, it may help a little bit, but sometimes you also need an appliance to actually do that for you instead of your muscles. You got to do it in the right spot. So that's combination therapy. It's using an oral appliance, so using like a mouthpiece plus a CPAP. And a lot of times it's just what you need.
That makes total sense. And I think that makes total sense. The woman who was talking about, she was talking even about the mask that we all wear right now when we go to the grocery store even. And so that was another piece, because I think you are totally right that if you are wearing a CPAP, is that, are you wearing it for the right reason, right? And then is it fit properly? Is there something else going on? And that's your wheelhouse.
Oh, yeah, sorry.
But knows that people aren't used to having something on their face. And so they're assuming all sorts of unique jaw positions that they have not done at a higher frequency as well. So this is something that for everybody who's watching, if you are having trouble and struggle with that, give Dr. Chad a call, because he can help you figure out, is there a big issue, or is it just mostly like situationally specific to what's kind of going on right now?
And another unfortunate thing with these, Ellen, so they trap air inside too, right? And one of the main problems is you're not expelling enough CO2. So you'll actually start to mouth breathe or over breathe because you have to wear one of these all day. And if you mouth breathe or over breathe, you've got to open your jaw up and you've got to jut it forward, and you'll get a lot of that strain there. So it is, and that's why you see a lot of people doing this. Like I said, they're self-soothing. They're trying to figure out how to do this, but they're trying to get their nose open so they can actually expel CO2 and get the right oxygen in.
Yeah, absolutely. So there's lots of good stuff from this webinar by far for people to start to think about, start to digest, evaluate your own posture, breathing, positioning, so that you can kind of start to not only educate yourself, but pick up some of those signs so that you might be able to link any sort of fatigue, headaches, any sort of jaw strain, or all these amazing conditions that Dr. Chad already referred to. So don't hesitate, call them. They are so wonderful. I can't tell you how amazing their office is, and it can be absolutely life-changing sometimes for people. I mean, I know Dr. Chad, we could probably be on here for 10 hours, and he could recount all of these amazing stories and experiences. But it's just, it would be worth your time if you have questions or anything that's going on to give their office a call. And they do consultations as well. So worst case scenario, you go and learn a ton. And that's a good day. Anytime you can do that is a good day. So thank you so much, Dr. Chad, for doing this and spreading the word and getting your information out there, because you are such a great resource that people need to know about. So I really appreciate your time. And thanks everybody who's tuning in. You did wonderful. And as usual, for the Mindset Way, we love you more than you know, everybody. Have a great day.
Thank you, guys. Thanks, Helen.